51. Rifampin can cause orange discoloration of bodily fluids? Answer: true. Rationale: rifampin is known to cause orange-red discoloration of urine, sweat, saliva, and tears. This is harmless but can stain clothing and contact lenses. SSRIs like sertraline commonly cause decreased libido, delayed ejaculation, or anorgasmia. 52. Sertraline is an SSRI that may cause sexual dysfunction as a side effect. Answer: true. Rationale: SSRIs like sertraline can cause decreased libido, delayed orgasm, or anorgasmia in both men and women. Thiazide diuretics like HCDZ can cause hypokalemia, not hyperkalemia. 53. Allopurinol should be discontinued at the first sign of a rash? Answer: true. Rationale: a rash may indicate a serious hypersensitivity reaction such as Stevens-Johnson syndrome. Allopurinol should be stopped immediately. Allopurinol is used for long-term prevention of gout, not for acute flare-ups. 54. Amoxicillin should be avoided in patients allergic to penicillin? Answer: true. Rationale: amoxicillin is a penicillin-type antibiotic and may cause cross-reactivity in those allergic to penicillin. Haloperidol, a typical antipsychotic, often causes EPS like tremors, rigidity, and tardive dyskinesia. 55. Nitroglycerin tablets should be swallowed whole for best effect. Answer: false. Rationale: sublingual nitroglycerin should be placed under the tongue to allow rapid absorption into the bloodstream, bypassing the liver. Combining sildenafil and nitrates can lead to life-threatening hypotension. 56. Levodopa-carbidopa may cause darkening of urine and sweat? Answer: true. Rationale: this is a known harmless side effect of the medication used in Parkinson's disease. Levothyroxine can cause weight loss if overreplacement occurs, hyperthyroidism. 57. Bupropion lowers the seizure threshold? Answer: true. Rationale: bupropion can increase the risk of seizures, especially in high doses or in patients with predisposing conditions. Methadone serves as an analgesic and is also used for opioid maintenance therapy. 58. A patient taking MAOIs should avoid foods rich in tyramine? Answer: true. Rationale: tyramine-rich foods can trigger hypertensive crisis when taken with MAOIs due to excess norepinephrine release. The first trimester is the most sensitive period for teratogenic effects on the fetus. 59. Haloperidol is associated with extrapyramidal symptoms, EPS? Answer: true. Rationale: haloperidol, a typical antipsychotic, may cause EPS such as dystonia, Parkinsonism, and akathisia. This harmless side effect is common and should be explained to patients in advance. 60. Sucralfate works by neutralizing stomach acid? Answer: false. Rationale: sucralfate forms a protective barrier over ulcers but does not neutralize acid. It should be taken on an empty stomach. Cephalexin is a cephalosporin, and there is cross-sensitivity with penicillins. 61. Methadone is used in opioid addiction treatment due to its long half-life? Answer: true. Rationale: methadone's long half-life allows for once-daily dosing and helps prevent withdrawal symptoms. Some antibiotics, including amoxicillin, may reduce contraceptive efficacy via GI flora alteration. 62. Enoxaparin is given intramuscularly for rapid anticoagulation? Answer: false. Rationale: enoxaparin, a low-molecular-weight heparin, is administered subcutaneously. IM injection may increase the risk of bleeding. INH depletes vitamin B6, pyridoxine, leading to neuropathy. B6 supplementation is often required. 63. A side effect of hydralazine is drug-induced lupus? Answer: true. Rationale: long-term use of hydralazine may lead to a lupus-like syndrome, especially at higher doses. Fluconazole is an antifungal, not an antibacterial drug. 64. Tamsulosin is used to treat hypertension? Answer: false. Rationale: tamsulosin is primarily used to treat benign prostatic hyperplasia, BPH, not hypertension. Sucralfate coats ulcers to protect them from acid, aiding in healing. 65. Vitamin B6, pyridoxine, can reduce peripheral neuropathy caused by isoniazid? Answer: true. Rationale: isoniazid can deplete vitamin B6, leading to neuropathy. Supplementation prevents this. Diltiazem, a calcium channel blocker, treats both blood pressure and heart rhythm disorders. 66. Diltiazem is a calcium channel blocker used for arrhythmias and hypertension? Answer: true. Rationale: diltiazem slows cardiac conduction and relaxes vascular smooth muscle, lowering blood pressure and controlling heart rate. Baclofen works on the CNS to reduce muscle spasticity. 67. Ferrous sulfate can cause constipation and black stools? Answer: true. Rationale: iron supplements often lead to GI side effects, including constipation and dark-colored stools. Loperamide is an antidiarrheal, not a laxative. 68. A serious side effect of clozapine is agranulocytosis? Answer: true. Rationale: clozapine can severely lower WBC count, increasing infection risk. Regular blood monitoring is required. Liver enzymes should be monitored when a patient is on valproic acid. 69. Diphenhydramine can cause drowsiness and should be used cautiously with other CNS depressants? Answer: true. Rationale: diphenhydramine, Benadryl, has sedative effects and may cause additive CNS depression with alcohol or sedatives. Enoxaparin is a low-molecular weight heparin administered subcutaneously. 70. Acetazolamide is used to treat glaucoma and altitude sickness? Answer: true. Rationale: acetazolamide is a carbonic anhydrase inhibitor that reduces aqueous humor and helps with altitude acclimatization. Bupropion, especially at high doses, increases seizure risk. 71. Sildenafil should not be taken with nitroglycerin? Answer: true. Rationale: combining these drugs can cause severe hypotension due to vasodilation. For potassium must never be given as a bolus. It can cause fatal arrhythmias. 72. Methyldopa is safe to use during pregnancy for hypertension? Answer: true. Rationale: methyldopa is a preferred antihypertensive during pregnancy due to its safety profile. It is a muscle relaxant, commonly used for acute musculoskeletal conditions. 73. Baclofen is a muscle relaxant that may cause drowsiness and dizziness? Answer: true. Rationale: baclofen acts on the central nervous system and may cause sedation and impaired coordination. NMS is a rare but life-threatening side effect characterized by fever, rigidity, and altered mental status. 74. Propylthiouracil, PTU, is used to treat hyperthyroidism? Answer: true. Rationale: PTU inhibits thyroid hormone synthesis and is often used in thyroid storm or pregnancy. Tamsulosin relaxes smooth muscle in the prostate and bladder neck, improving urine flow. 75. A side effect of isoniazid is hepatotoxicity? Answer: true. Rationale: isoniazid can cause liver damage. Liver enzymes should be monitored during therapy. It restores glutathione and prevents liver damage when given promptly. 76. Varenicline is used to manage nicotine withdrawal? Answer: true. Rationale: varenicline, Chantix, is a partial nicotine receptor agonist used for smoking cessation. Common anticholinergic effects of diphenhydramine, Benadryl. 77. Misoprostol is contraindicated in pregnancy? Answer: true. Rationale: misoprostol can induce uterine contractions and cause miscarriage. Buspirone has minimal sedative effects and no dependency potential. 78. Omeprazole is a proton pump inhibitor that decreases gastric acid production? Answer: true. Rationale: omeprazole irreversibly inhibits gastric proton pumps, reducing acid secretion. Fatal precipitates may form. Avoid mixing in neonates. 79. Alendronate should be taken with food to prevent stomach upset? Answer: false. Rationale: alendronate must be taken on an empty stomach with water. Food interferes with absorption. A nitrate-free interval, e.g., overnight, is needed to prevent tolerance. 80. Dextromethorphan is a cough suppressant found in many OTC products? Answer: true. Rationale: it acts on the cough center in the medulla to suppress coughing. Used for alcohol aversion therapy, it causes nausea, flushing, and palpitations with alcohol intake. 81. Trazodone is primarily used to treat insomnia at low doses? Answer: true. Rationale: though an antidepressant, its sedating effects make it useful for insomnia at lower doses. Codeine is metabolized variably, and some individuals may convert it rapidly to morphine. 82. Mannitol is contraindicated in patients with heart failure? Answer: true. Rationale: mannitol increases plasma volume, which may worsen heart failure. Especially in the elderly or those on steroids, fluoroquinolones can weaken tendons. 83. Lactulose is used to treat hepatic encephalopathy by reducing ammonia levels? Answer: true. Rationale: lactulose traps ammonia in the colon and facilitates its excretion. Loratadine is a non-sedating antihistamine, unlike first-gen antihistamines. 84. Cyclobenzaprine is a centrally acting skeletal muscle relaxant? Answer: true. Rationale: it reduces muscle spasms by acting on the brainstem. It can disrupt gut flora, allowing C. difficile overgrowth. 85. Ethambutol can cause optic neuritis? Answer: true. Rationale: visual disturbances, especially loss of red-green discrimination, are possible with ethambutol. One of the most common side effects is decreased appetite and potential weight loss. 86. Dronabinol is a synthetic cannabinoid used to stimulate appetite in HIV/AIDS patients? Answer: true. Rationale: it helps treat anorexia and weight loss by increasing appetite. Omeprazole is a proton pump inhibitor, PPI, not an H2 blocker. 87. Theophylline has a narrow therapeutic range and requires regular monitoring? Answer: true. Rationale: therapeutic levels are narrow, 5 to 15 mcg/ml. Toxicity can cause arrhythmias and seizures. Calcium in dairy reduces iron absorption. Take iron with vitamin C instead. 88. Raloxifene is used to treat osteoporosis in men? Answer: false. Rationale: raloxifene is approved for use in postmenopausal women, not men. Patches are for chronic pain in opioid-tolerant patients due to overdose risk. 89. Colchicine is used to treat acute gout attacks. Answer: true. Rationale: colchicine reduces inflammation and pain during acute gout flare-ups. It's a cholinesterase inhibitor that may improve cognition or delay decline. 90. Magnesium sulfate toxicity may cause respiratory depression and loss of reflexes? Answer: true. Rationale: high levels depress the central nervous system and require calcium gluconate as an antidote. Monitor ECG if patient has cardiac risks. Macrolides can prolong QT interval. 91. Sumatriptan is used to prevent migraines from occurring? Answer: false. Rationale: sumatriptan is used to abort acute migraines, not prevent them. Propofol is a sedative/anesthetic, not associated with psychosis. 92. Ketorolac is a potent NSAID that should not be used long-term? Answer: true. Rationale: risk of GI bleeding and renal toxicity limits use to 5 days or less. It is a urinary analgesic, not an antibiotic, used for symptom relief. 93. Timolol eye drops are used to lower intraocular pressure in glaucoma? Answer: true. Rationale: timolol is a beta blocker that reduces aqueous humor production. A common nickname for this side effect is Dopamax. 94. Finasteride is used to treat male pattern baldness and BPH? Answer: true. Rationale: it inhibits 5-alpha reductase, reducing DHT levels. Can cause hypertensive crisis if diet isn't controlled. 95. Epoetin alpha may increase the risk of hypertension and thromboembolism? Answer: true. Rationale: it stimulates RBC production, which may raise hematocrit and blood pressure. It's a synthetic erythropoietin used in anemia, especially in CKD. 96. Metoclopramide may cause tardive dyskinesia with long-term use? Answer: true. Rationale: it blocks dopamine receptors, which can lead to extrapyramidal side effects. Clozapine is reserved for treatment-resistant cases due to risk of agranulocytosis. 97. Linezolid can cause serotonin syndrome if combined with SSRIs? Answer: true. Rationale: linezolid is a weak MALI and can interact with serotonergic drugs. It's an alpha-glucosidase inhibitor used in diabetes management. 98. Loperamide is used to treat diarrhea by slowing intestinal motility. Answer: true. Rationale: loperamide acts on opioid receptors in the gut, reducing peristalsis. Given to mothers at risk for preterm delivery to promote surfactant production. 99. Desmopressin is used to treat diabetes insipidus and nocturnal enuresis. Answer: true. Rationale: it mimics ADH, reducing urine production in central DI and bedwetting. It relaxes skeletal muscle and treats this life-threatening reaction. 100. Rosuvastatin is primarily used to raise HDL cholesterol. Answer: false. Rationale: rosuvastatin mainly lowers LDL cholesterol. It may modestly increase HDL, but that's not its primary effect. Patients should avoid alcohol during and 48 hours after taking it.